So what if there was a virus that affected about 1 in 3 adults in the United States, and that viral infection was associated with a decreased activity and ability to work, heart disease, endocrine diseases like diabetes mellitus. It increased the risk of high blood pressure, hypertension, stroke, intestinal problems, and cancer. And not only did it affect humans, but it affected dogs and cats in the United States at about the same percentage, around 30 to 40% of dogs. What if it not only caused and was associated with those diseases, but if it was associated with an increase in likelihood of death and therefore a shortened life expectancy? And what if it was really easy to diagnose and treat? And that's really what we're talking about with obesity. It is a disease that when you look at the most recent information I could find in humans, that affects somewhere around 25 to 35% of adults in the United States. The kind of yellow or kind of light orange, and the different orange and red colors are somewhere around 25 to 35%, and there are a lot of states that fall in that percentage. The lowest percentage of obesity in adults in the United States is Colorado, and the highest is Mississippi, and there are a lot of orange and dark orange. And so it is a disease, and unfortunately it's also a disease that affects our children, not only our two-legged children, but our four-legged children as well. So how do we define obesity? Well, there are lots of ways to do it, and there are lots of different definitions that people use. Typically what's used is a measure of how much body fat that you or your dog may have. That is, quantitatively, it is body fat content above around 15 to 20% beyond what would be considered ideal body weight and body fat content. It can also be discussed in terms of a functional problem. That is, it's accumulated fat deposits that impairs something about your health or function, or kind of more general, it's just basically an excessive amount of fat. And what's known, at least in people, is that the distribution of that fat's important. That is, whether it's kind of around the midsection, the apple shape, or kind of it's around your rear end and on your legs, kind of that pear-shaped appearance. Now, there are ways to measure the amount of body fat, but actually, even in people, the best that can be done and the most reproducible is actually to do what's called body condition scoring. And what that does is it allows you to get an estimate of kind of a rough estimate of the amount of body fat relative to the size of the dog or cat. And people, they of course have actuary tables, and it's not quite so easy, especially in dogs. The variability of body size in that species, from a little 1 or 2 pound teacup poodle to a 200+ pound wolfhound or mastiff, and that is a large amount of variability in body size and composition for any one species. And you don't really see that in other species except for maybe horses. So what we do as veterinarians is we can do what's called a body condition score. And there are several that are out there, and this chart that you should be seeing on the slide shows both a 5-point scale and a 9-point scale, and how they relate to the amount of body fat that would be present if you actually measured the amount. The middle of the scale represents an ideal body condition, so a 3 out of 5 or a 4 to 5 out of 9 represents an ideal body condition, and those dogs and cats typically have a body fat content of around 15 to 20%. Physically, what we notice, and what you can notice in your pets, is that when they're in optimal condition, they have an hourglass appearance. If you stand above them, they have that indentation behind their ribs. You can run your hand along the side of their chest, and you can feel the ribs, but there's a little bit of cushion in between your fingers and the bone. You can run your hand along the back, and you can feel the tops of the spine, but again, there's some cushion there. And they don't have obvious deposits of fat. They don't have the fat that kind of hangs down between their back legs. They don't have the big saddle bags over their rear ends. They don't have the fat that accumulates around their neck. If you go down in number, or on the slide up on the slide, to lower numbers, so to a 2 or 1, then those are various degrees of underconditionedness. That is, less and less body fat and typically less muscle mass as well. So that when you get down to a body condition score of 1, whether it's out of 5 or 9, then those dogs are very emaciated and they have usually less than 5% body fat. And as you go up the scale in number, or down on the left side of the slide, to 6, 7, 8, 9, or down to 4 or 5 out of the 5-point scale, then those represent various degrees of overconditionedness. That is, more and more body fat. And so a dog with a body condition score of 4 out of 5 will have somewhere around 25 to 35% body fat. When you look at them, you can see that they have a little bit more cushion, a little bit more padding. When you stand above them, they kind of are starting to lose that indentation behind their ribs. They have some fat deposits between their legs and over their tail head, around their neck. When you run your hands on them or run it along their ribs, it's hard to feel the bony prominences, the tops of the spine, the ribs. And when you get to the bottom of the scale, 5 out of 5 or 9 out of 9, then those are pets that typically have more than 45% body fat. And they're so obese that they've lost that hourglass appearance. They're just sort of round. And there's a lot of fat under the skin, along the underside, and then in the groin area. There's a lot of fat rolls around the neck and over the tail head. And that becomes important because I'm going to show you and try and convince you in this short presentation that this is more than just they're pleasantly plump, that there are a lot of problems associated with it.